Hello.
Misbah, your audio is off. You can start.
Okay. A very good evening, everyone. I, Dr. Misbah Kadri, and Dr. Akshita Gupta, on behalf of Team Cynodent, welcome you all to the webinar series 2023. Theme of the series is Unlocking the Trends in Dentistry. For the first session of today, I would like to invite Dr. Amit Bhardwaj, sir. He did MDS, PhD, FICD, FPFA. He is a professor and head Department of Periodontology at Faculty of Dental Sciences, SGT University, Gurugram. Topic for this session is Periodontology Clinical Perspective. I would like sir to please start with this session.
Hello. Thank you. Good evening, everyone. I would like to thank Team Cynodent, Dr. Anmol Bagaria, ma'am, Dr. Akshita Gupta, Dr. Misbah Kadri for coordinating for hold this webinar today. I am Dr. Amit Bhardwaj. I am Professor and Head Department of Periodontology, SGT University, Gurugram. I am here to discuss a very basic topic, periodontology as clinical perspective. Because what we are facing nowadays that people are not much inclined toward the specialty of periodontology, especially our clinical friends, our colleagues who are practicing their dentistry day in, day out. But somehow, as a fraternity, as a faculty, as a senior member of this periodontology, I personally feel that we need to encourage this specialty so that the new budding dentists can get more aware that what is the perspective of this branch and what all they can do in their routine practice to enhance their periodontology. So I will be covering this topic by explaining few basic instruments, armamentarium, which keeping them in your inventory, you can use them on a regular basis. And secondly, I will be sharing few photographs of some very basic cases which you can perform by just convincing the patient. I am very much sure that you get these type of patient in your practice, in your institutes, in your anywhere you are in your organization. But somehow you have to be very keen in observing these clinical findings so that you can advise your patient that, sir, you are having this problem which may be enhanced during your next course of life. So kindly get it rid now itself. So So these are the basic armamentarium which we usually display in our uh, periodontology clinics, which comprises of very simple diagnostic kits, which include mouth mirror, our periodontal probe. I will highlight this that periodontal probe is very important. You must keep 4, 5, 6 to 8 probes as per your patient footfall in your clinic. Don't use endodontic probe for periodontal purpose. So I will recommend if you can have UNC 15 probe, then it will be a good instrument. Then you must have neighbors probe to detect the furcation involvement. Then tweezer and few basic instruments. Then we have a full range of surgical instrument which starts from curates, Gracie curate specially, then universal curates, few bone files, chisels, scissors, Copac, which is also very important after performing any periodontal surgery, whether minor, major, you can always place a periodontal plaque. And obviously, yes, a local anesthesia, gloves, mouth mask, pieces of few gauge piece. So this is the very basic armamentarium which you can have for any periodontal procedure. Now coming to diagnostic instrument, as I have informed, mirror, UNC 15 probe, neighbors probe, specifically for furcation involvement. If you take any radiograph for molars or multi-rooted teeth, kindly go through clinically with the help of neighbors probe to detect which type of furcation is present. Grade 1, grade 2, grade 3, grade. Then tweezer. Then for any periodontal surgical procedure, we need BP blade, Very commonly used blade numbers are 11, 12 and 15C. As you can see in this picture, all three are visible. Then comes our periosteal elevators. Periosteal elevator means you can elevate a periosteal flap with the help of these two instruments. They have particular number, whichever you feel and whichever is suitable for your desired position or location of the tooth, you can use them. Then comes the set of curates, which is a universal curate, which comes with 2R, 2L, 4R, 4L, which can be used anywhere in the mouth, as name suggests, universal, and very good set of Gracie curates, starting from number 1, 2, 3, 4, 5, 6. It comes in bi and two-ended instruments with one number on one side and second number on the other side. Like this, you can have at least 7. We have good range of Gracie curates. Some modification also are available, but if you have 7, that is up to number 14, it will serve your purpose. Then comes some bone shaping instruments. As periodontal disease lead to various deformation in alveolar bone surrounding the tooth, so sometimes you need a good bone file to reshape the bone for resective osseous surgeries. I will not advise any handpiece or any burr, because that can generate excessive heat, and that the speed is not in control of dentist. So better use either Schluger file or Sugarman file, as you can see in these two pictures. So bone file is a very good instrument. Then comes tissue trimmers instrument. For example, two scissors, Castrovillo, Goldman Fox scissor. Very good fine scissors. You can debride any tissue tag. You can clear any excess tissue with the help of these two scissors. Very fine tipped scissors both. Then comes our forceps, suture cutting scissors and needle holders. After performing any surgery, if you feel you have to place sutures, then these three instruments will help you in placing of suture and cutting of suture. Then, as I said earlier, periodontal dressing, which is co-pack, very commonly available and very easily seen in periodontal clinics. You must place periodontal dressing as per the need of the surgery. This will provide a good comfort to the patient post surgically. Then, as I said earlier, there are few 14, 15 very basic periodontal procedures which you can convince to your patient as per their need. But the idea of today's lecture is you must know the importance, the clinical features, and treatment plan to perform any of them. So they are scaling and root planing, gingival curettage, operculectomy, depigmentation, gingivectomy, periodontal abscess drainage, soft tissue excision, frenectomy, surgical crown lengthening, vestibuloplasty, resective osseous surgeries, regenerative surgical procedures, perioplastic surgeries, and hemisection. So these 14, 15 procedures are very commonly advisable in your day-to-day practice. Now coming to importance of scaling and root planing. Whenever you feel or you see any this type of condition or more, sometimes you get some better cases, sometimes you get some more worse cases. So kindly advise scaling followed by proper root planing and polishing to your patient so that you will get the desired result. Your gingival inflammation will reduce by performing very good scaling. And that is up to you whether you perform hand scaling or a ultrasonic scaling. The only objective is to get a very neat and clean tooth surface so that gingival inflammation may be reduced. So this is one picture of pre-operative and post-operative, and obviously believe me, whenever you perform any good scaling, patient themselves will inform you that, sir, I am feeling very much relaxed, I am not getting any sensation, pain is much more relieved. So good scaling is a key to success for many periodontal procedures. In routine also, 6 monthly you should advise your patient. Then gingival curettage, what we will perform, basically if after having scaling and root planning, patient is not getting comfort and we feel that there is a pocket depth and surgery is not required, we need to curate the necrosed gingival pocket lining, then gingival curettage is the choice of treatment. Only thing is we need to give local anesthesia to the patient. Then with the help of Gracie curate or universal curate, we can perform this procedure. And this is also a very result oriented procedure. Patient will get relieved very soon. Then comes operculectomy. Many patients come with the pain, or sometimes they say that we were all right last night but suddenly this happened, we are getting pain in our last tooth. So on clinical observation you will feel that there is some time semi erupted or unerupted or partially erupted last molar is present in the mouth, whether in maxilla or mandible, right side or left side, but there is a covering of tissue which is known as operculum, and removal of that tissue is known as operculectomy. So this is also a very common procedure which is performed under local anesthesia and it will give immediate relief to patient. So kindly always have a look on a molars of patient. If he or she is having this operculum, kindly advise them, because maybe they visited you today evening and suddenly same night they develop this uh, inflammation with the due to any food lodgement or something like that. So you can advise them that sir, please get it done, otherwise in a later course of time it you will have pain or you will have inflammation like that. Then come depigmentation. This is a cosmetic aesthetic procedure, but very sometimes patients are very much particular about their condition of having a black band on the gingiva, especially in maxilla, and those have a gummy smile. They will observe it very commonly, and they will come to dentist that sir iska kuch kar dijiye. Then sometimes if dentist is not aware what to be done, how to be done, then it will be a problem. So this is a very good case in which we have done uh, depigmentation with the help of blade, scalpel. You can use cautery also, you can use laser also. Dental laser, soft tissue laser is a very good option to get it done. And believe me, you will get a very good pink gingiva. The turnover rate may be fast or slow depending upon patient genetic makeup, but yes, immediately he or she will get relieved of this black band. Very good aesthetic treatment procedure, especially in case of gingival visibility. Then comes gingivectomy. This is also a treatment if patient feels that he or she is having a gummy smile and you feel yes there is a good enough smile line is visible while patient is smiling, then you can advise gingivectomy procedure. What you have to perform is you have to measure the excess gingiva with the help of pocket markers, which comes in a two instrument, right side and left side. Pocket marker is also very important instrument for a periodontist or any general practitioner. Then you can, as you can see in this picture, third picture from the upper side, there are some few dots in which there is a marking with the help of pocket marker, and then just keeping a blade, just a pical to these markings, you can remove the excess band of gingiva and patient will get rid of excessive gingival smile, gingival display during smile. This is also a very result oriented procedure, gingivectomy. So you can use this very commonly. Periodontal abscess drainage, again a very painful condition sometimes, but usually gingival abscess is a painful condition. Periodontal abscess is not that painful, but yes, patient will say that discharge is coming from the uh, gingiva. Then you have to examine properly, take radiograph, feel it, and with the help of just excision or with the help of just curate, you can perform abscess drainage and remove the all pus and put patient on antibiotic. It will get relieved. But you must see this patient very carefully that whether he is having gingival abscess or periodontal abscess. Clinical features are different, but sometimes it is very difficult to differentiate whether the origin is of gingiva and or periodontal. Periodontal abscess, usually patient will complain for long standing, and gingival abscess patient will say that last night or few days back he was absolutely okay, then something got stuck in his gingiva, or he got some trauma from the any toothbrush injury or toothpick injury, that will cause gingival abscess. Soft tissue excision, very commonly done procedure, especially in localized site. You can use scalpel also, you can use laser also, depending upon patient choice, depending upon your choice. Both will give good result, and immediately you can send the sample to oral pathology for any differential diagnosis or any particular diagnosis of this enlargement. So excision is a very easy to perform procedure. Frenectomy, it is a very common. Sometimes patient will complain of diastema. Kindly have a look on their frenal attachment. If frenal attachment is high, please recommend your patient to go for frenectomy. Only thing you have to be, you have to have all armamentarium with you, anesthetize the site, hold the frenum, cut it from the upside downside and remove. A kite shape appearance will come as in picture. Suture it, leave it, patient will come, remove the suture, and you will observe a good result. And uh, you can give a composite for coverage of the diastema which has already occurred, but henceforth it will not progress. So frenectomy is also a very common procedure. Then crown lengthening. Few of our prosthodontic friends send patient to us that we need to place implant, but there is a shortage of gingival space. So what we can do, we can measure it with the help of our UNC 15 probe, that if alveolar bone is needs to be removed to maintain gingival sulcus proper, then you perform with the help of local anesthesia, raise the flap, re- uh, remove some alveolar bone, and cut the excessive gingiva, and you will feel, and patient will feel, and prosthodontic feel friend will get helped with your this minor procedure, that yes, now sufficient crown is available so that he or she can place a good crown prosthesis over it. So it can be done either with bone contouring or without bone contouring, depending from case to case. Vestibuloplasty, to increase the width of attached gingiva, very good procedure to increase the width of deep. If the vestibule is very shallow, then you can do this vestibuloplasty to increase the depth. It is a very helpful procedure, and patient will perform dental cleaning routinely with a good zeal. Resective osseous surgeries, as name suggests, this is a resectioning of bone which is around the tooth. Sometimes patient will have negative architecture instead of positive architecture. So as I informed earlier, we need to have good bone file, so that you can trim the excess bone which is otherwise in negative position now. Earlier it used to be in positive architecture, or later due to disease, due to bone periodontal disease, it get deformed. Now you have to reshape it so that the disease will not progress. So this is osseous surgery. It will be done under local anesthesia. Flap will be raised. See the condition of underlying bone. Take your wise decision which bone you need to trim, which bone you need not to trim. Then place the suture, flap back, place the suture, send the patient, take good radiograph, and keep it for your record purpose. And definitely you will feel that patient is relieved, and now disease will not progress. As we did the case, you can see bone will start forming after few months. Regenerative surgical procedure. Earlier we did resective, in which bone needs to be trimmed. Regenerative means we need to regenerate the bone. So we have to use any bone graft, any GTR membrane, any other supplement to enhance the bone where it is lost in periodontal condition. So again, anesthetize the patient, raise the flap, see the underlying condition, fill the bone graft of your choice, whether autogenous, alloplast, xenograft, whichever is suitable, whichever is affordable, whichever is best for your patient. Place the suture back, take radiograph, and you will feel that yes, there is a regeneration of lost alveolar bone. Like in this, you can appreciate that there is a development of bone, although it is a slow procedure, but definitely you will get bone if you use a good graft, and patient need to maintain it properly. Then some free gingival grafts can be placed in the treatment of periodontal recession, gingival recession. These will come under perioplastic surgeries. Free gingival graft, where we take one graft of a desired site from donor site and place it on a recipient site and suture it back and tell patient to maintain well so that you can get good result. The best choice is palate. Take the graft of your desired size, place it, suture it nicely so that it will not dislodge, and pack the donor site also, pack the recipient site also to get desired results. This is a coronally advanced flap in where the single tooth recession is there. You can just slide the flap coronally advanced, as name suggests. You need to cut the flap. No need to cut it completely. Just maintain the blood supply intact for the graft and just slide it coronally. Leave it. It will get placed properly, and you will feel that recession is somehow treated with the as compared to your previous. So Shelley's technique, very good technique where you have multiple recession. You can perform this technique for at least anterior 4 teeth, anterior 6 teeth. And take a proper cut, take a thorough debridement, clean it, everything, suture it back, and you will get a good desired result in multiple tooth recession. Hemisection, where you need to take good decision whether you want to save the tooth, whether you want to save half tooth, or whether you want to remove it. If hemisection is desired, go for RCT. Choose the root which needs to be extracted. Take the wise decision as per your clinical expertise, that if you go for mesial root, if you go for distal root, palatal root in case of maxilla, which root needs to be extracted, which needs to be protected. So take a wise decision and place a crown. Patient will feel that the natural tooth will work for him instead of implant or something. So advantage is very basic armamentarium is required. It gives more precision to clinician during surgery. The armamentarium, which I have explained, has very good advantages. It is a very basic. You can keep it for your regular practice. Tactile feeling is very good. You will observe that you are getting a good feel while performing any curettage, any incision, any root section, anything. It causes less damage to the surrounding tissues because everything is in your hand. What pressure, what direction, what force, how much time, all instruments are in your hand, so it will give good results. And tissue approximation can be achieved with the help of proper suturing. So what I have explained you in my previous slide is the basic procedures which you can perform day in day out just by convincing the patient. Now I am explaining few 4 5 things which, if you wish to add on your inventory, you can use them. Minimal invasive surgical technique. Periodontal surgeries can be performed with normal instrument also. Periodontal surgeries can be performed with the help of micro instrumentation also. So if you have micro instrument in your inventory, kindly go for minimal invasive surgical techniques using a surgical loop, so that you will get a good result, especially in case of recession treatments where root coverage is desired. Dental lasers very commonly used nowadays. As per your need, you can choose if you have soft tissue laser, if you have hard tissue laser, whichever is your preference, you can buy it and use for all your procedure. So dental laser is also a very helpful tool. Dental implants in perio, we nowadays we are shifting to guided implantology, also conventional implantology also. A periodontist can do very well with the taking the care of gingival tissue, because the hands of periodontist are very fine, so they perform implantology in a good sense, means without damaging the surrounding tissue unnecessarily. Or as I suggested earlier, dental loops are very commonly used. Have a good pair of dental loops with a mounted light. Dental operating microscopes is also upcoming. People are having in their private practice. Institutional wise, mostly institutes have dental operating microscopes. But I suggest, if you can afford, if you can get trained, there are fellowships available. Go for it and use dental operating microscopes. Then growth factors are very commonly used: PRP, platelet-rich plasma, platelet-rich fibrin, etc. Some growth factors are readily available. Some growth factors you need to take from the patient's blood itself. So you must have a good centrifuge machine. Chokran machine is very commonly used, and it will give a very good desired result in case of regenerative procedures with the help of GTR membranes. Use a good size of suture, good needle, so that you can get good results. So believe me, if you will not upgrade yourself, you will lose the charm of the dentistry, and you will start losing your patient also. So with this photo, which is self-explanatory, you can also have some good piece of advice from me and from your colleagues from your past, that yes, you need to upgrade in all your fields, perio also and general dentistry also. Thank you. A few pictures. My colleague Dr. Anurag Bhatnagar have supported me for few clinical photographs for this presentation. Thank you.
Thank you so much, sir, for such an enlightening lecture. With your permission, I would like to proceed with the question answer round.
Yes, please.
So the first question we have is, what is the best way to do operculectomy? Is it laser or is it surgical?
Uh, Surgical is better because you will get good access, both buccal side, both lingual side, as well as distally also. As I said, when you do with the scalpel, now you will have a good feel that you are going in the good direction, good space, good, everything is in your command. So laser is good, but scalpel will give desired result with economical to patient also.
So the next question we have is there any specific brand that you would recommend for periodontal instruments?
Yes, Hue 3D instruments are quite popular, and they are long lasting, and they are brand leader in this whole uh, scenario.
Thank you, sir.
Periodontal instrument Hue 3D is good.
Thank you, sir, for your answers. I would like to thank Dr. Anmol Bagaria, ma'am, founder Cynodent, and Dr. Ashish Chandra, sir, co-director Cynodent, and my co-host, Dr. Misbah Kadri. Thank you to all the delegates who have joined, and I would like them to please subscribe to our YouTube channel for daily updates and webinar updates. Thank you.
Thank you so much,
everyone.
sir.
Thank you, sir.
Thank you, Dr. Anmol, Dr. Ashish, Dr. Misbah, Dr. Akshita, and all my listener, viewers, friends, colleagues, dear students. Thank you.